Hello and welcome everyone. My name is Crystal Dalmaso and I'm a Community Support Specialist at DECA. Evaluation is at the heart of every step your coalition takes. Planning, action, and celebrating. Meaning evaluation begins before implementation and is important for future decisions about sustaining strategies. Evaluation is all about making sure the right information is gathered in the right way and is provided to the right people. It tells us how things are working. Evaluation helps you understand what strategies are working and which are not working in a planned and organized way. The results of your evaluation may be used to refine program implementation, concretely illustrate progress towards program goals, and ultimately recruit funding for evidence-based programming. The goal of the Strategic Prevention Framework is to implement evidence-based strategies and programs that fit with your population's needs. Evaluating the strategies you have chosen can help you to determine whether the strategies do, in fact, meet your community's needs and whether they've been effective. The two types of evaluation are process evaluation and outcome evaluation. Each type of evaluation answers different questions and therefore has different intentions, measures, and quite often different data sources. Using these types of data will help you monitor implementation, improve implementation and performance, and will also help determine which interventions and outcomes should be sustained. Process evaluation documents all aspects of the implementation of a strategy. It describes how the intervention was implemented. For example, what materials were used? What methods were used to implement the strategy? Was the strategy implemented with fidelity or were there modifications made? Outcome evaluation documents whether the strategy made a difference, and if so, what changed? It documents the effects after the intervention was implemented. Outcome evaluation is connected to the long-term and short-term outcomes. Process evaluation measures the activities and actions you took to implement the strategies that will help you meet your goals. Essentially, the who, what, when, why, and how. Some examples of process evaluation tools that could be used are attendance lists, meeting minutes, strategy or activity checklists. Capacity building goals and objectives are best measured by process evaluations, as are implementation targets. A community will need to identify short-term and long-term desired outcomes to achieve with its overall comprehensive prevention plan, as well as for each strategy it implements. Remember, if the strategy does not address the underlying risk and protective factors that influence the problem, then it's unlikely to produce the desired outcomes or changes in that problem. Short-term outcomes can be identified by the length of time between the strategy implementation and the measured outcome. However, the most important difference is the effect the intervention has on the outcome. Short-term outcomes can be directly tied to the strategy, while long-term outcomes can be less directly attributed to the program. In general, short-term outcomes are measured at the end of the program or soon after the program has finished, whereas long-term outcomes can be measured 6 months, a year, or even several years after your program completion, and includes changes in conditions, policies, or organizational structures. There are 5 basic functions of a coalition's evaluation process. Involvement helps the community build skills and improve its health. This is ultimately the most important function of the coalition. Coordination involves communication between diverse partners, knowing what everyone is doing and keeping them engaged over long periods of time. Ask the question, does this evaluation help our coalition keep track of its work? Evaluation results should help members know what the others are doing, reveal how the work fits together, and reveal opportunities for working with other partners. Accountability involves tracking the value that's added. This function is about tracking the specific things that everyone does. The question to ask here is, does the evaluation hold your coalition accountable for community-level desired outcomes? Everyone involved should know what role your coalition plays. Sustainability is a long-term goal, asking the question, does the evaluation help the coalition sustain itself for long-term goal achievement? It helps tell coalition members their stories by systematically telling what the coalition does, why it exists, how they make a difference in the community, and why their unique approach needs to be sustained. Information about how your coalition is doing can be important for gaining long-term support from the community and other stakeholders. Celebration is important. Does the evaluation help the coalition celebrate its success along the way? Taking time to celebrate reminds the coalition members that they're making an impact and reminds the community that the coalition is playing an important role. While evaluating, you'll want to keep the exampled questions in mind. The answers to these questions are especially important given the current fiscal climate in which using fewer resources may be expected to produce greater results. The first step in designing an evaluation is to pull together a team of people who will oversee the evaluation process. Remembering that evaluation begins before implementing the intervention, so create your team early. These may or may not be the same people who are involved in your needs assessment and strategic planning process. However, these individuals should be willing and able to be responsible for implementing the evaluation activities. Ask the coalition whether anyone is interested in being part of an evaluation subcommittee, and try to get a good community and stakeholder representation. It's also helpful to have someone on the team who is knowledgeable about research practices. Evaluating questions can serve as a guide during the evaluation process. It is important that you should focus your evaluation on one or just a few strategies that are most important to your community and your evaluation team. Keep it manageable. You can always add more questions to your evaluation or change the questions that you choose to focus on. Evaluation measures are simply the information you're going to use to answer your evaluation questions. When developing the evaluation measures, your evaluation team will want to make sure that the measures they select are a good fit for the strategy and the evaluation question. A good fit considers both what you can measure as well as what meaning you can derive from it. Put another way, does the measure help you answer your question? Evaluation measures should follow the SMART principle. Specific, a rate, a number, percentage, or frequency that can be linked to an observable action or behavior or achievement. Measurable, a system, method, or procedure which allows the tracking and recording of the behavior or action upon which the measure is focused. Achievable, the identified measure can be collected and analyzed by your organization without undue burden or hardship. In other words, there is a likelihood of success in collecting the measure, but that does not mean it is easy or simple. Relevant. This means two things: that the measure or indicator being selected is something the organization will impact, and secondly, it relates to the objective being evaluated. Time-based. The measure can be collected and analyzed over time, allowing for targets and benchmarks to be established and assessed. There are two types of data collection methods. Qualitative methods answer why and how, and usually involve talking to or observing people. Emphasizing words instead of numbers, qualitative methods present the challenge of organizing the thoughts and beliefs of those who participate into different themes. According to SAMHSA, qualitative methods can be useful for describing a situation and can provide insight for your intervention approach. Quantitative methods answers the questions of who, what, where, and how much, emphasizing numbers. They target larger groups of people and are more structured and standardized. For example, the same procedure is used with each person. SAMHSA addresses quantitative data on the website, and some areas identified to find quantitative data are pre-existing records like accident rates on healthcare claims, or self-report surveys, or drug testing reports. Using both methods will be helpful to tell a more complete story of what's happening inside your community.